Are you unknowingly breaking FDA rules with your PRP or adipose treatments? Regulations aren't gone, they're just evolving.
Just curious, why aren't we concerned about any regulatory issues surrounding using adipose as a source of cellular therapy anymore? Why are we not concerned?
Find out what's allowed and what's a red flag. Watch this.
Well, I think we are concerned, but a couple of things. So what the FDA cares about is that you don't destruct the adipose tissue down to the level of cells. They have approved products, 2 of them, more than that, that get rid of the adult adipocytes. You have your mesenchymal cells there at the vascular network and a little bit of kind of fragmented fat that is below a certain size. That has been okayed by the FDA. But what hasn't been okayed by the FDA is, again, using enzymes, getting down to the cellular level, because that's a product. And so we are worried about that. If someone is using enzymes in a clinic and then giving a pure adipose-derived cells to it, I would be worried about the regulatory, and they're going to get shut down. It's just a matter of time. So that is a worry. The micro-fragmented MFAT, that sort of thing, I'm not sure, right? Because there's products out on the market and devices from companies to help produce it. I think that's legit things to do.
Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, the business of orthobiologics, and tune in.
Obviously, you check with your product that is help machine these fragments of fat, and then make sure that it's FDA approved. That's the way to be bulletproof with it. But I think there's less policing in that area, and the more of the rogue of the allogenic cells, the amniotic, again, derived cells from other patients. I mean, that's where the kind of police are out, so to speak, right? That's where it's really, they're going to shut you down. You're doing MFAT in your clinic. I have never even heard of it anywhere. Yeah. So I think
there's some concerns. I think people are concerned with the FDA, the wording about whether you're using it, for homologous use. People get hung up on this, but I think that's for the marketing of it for companies. That part of this guidance from the FDA is guidance to the companies who are marketing these devices. The way that the individual physicians are using it is a completely different ballgame. And so, should you put that you use adipose cells to treat arthritis on your website? I wouldn't. I kind of liken it, and people always ask, well, why can they sell adipose or the umbilical stem cells? Why can they sell it? And I tell them this: do you speed when you're driving your car? Of course, we all do, right? I mean, most of us do. And that's illegal. That's not a legal thing. We are breaking the law when we speed. It just has to do with the ramifications. And so if you're speeding in your minivan versus if you're speeding in your red Lamborghini at 105 miles an hour, who's going to get caught and who's going to really catch the attention of the police, right? Well, it's not the 5 mile an hour over in your minivan. And so when we talk about that worry about the adipose and specifically the MFAT using the 510K cleared devices, I think that the risk is very, very minimal. And then if you're not even talking about the fact that if you're using it as it is intended for cushioning and homologous use, if you read the actual literature and in the recommendations from the FDA, I think you are well within your purview as a physician to use it.
Autologous.
Yes, autologous, not umbilical. So MFAT, yes. Umbilical or birth product, no, not at this point, but maybe in 2026, right? 2026 is going to be the revival of some really cool things that we can use for our patients. I'm looking forward to that for exactly those patients that you talked about, because I don't have a good answer for those people currently.
don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my Orthobiologics Masterclass, come join us.